Hello guys, welcome back to my channel. So today we are going to discuss about like you are a junior doctor working on floor in a gynae and obstetric ward. So a patient under your care recently had a hysterectomy done few hours ago, and a nurse has rushed to you stating like this patient who had a hysterectomy done few hours ago, her blood pressure is dropping. Or it could be any patient, you could be in the surgical ward, it could be any patient, post-operative patient. Nurse is coming to you and nurse saying like, doctor, this patient blood pressure is dropping, can you quickly come and assess the patient? So in this way what you will do, you will go and assess the patient. You have to follow the ABCDE approach, and please keep in mind before going into the examination room, a scenario will be pasted on your door. So it can say you are a resident doctor working in the obstetric gynae department, or it could be a surgical department, and it can say like Mrs. Julie, a patient 58-year-old and a hysterectomy done an hour ago, and nurse can say can you please come and assess her as she is hypotensive, her blood pressure is dropping, her oxygen saturation is dropping. So what you have to do, assess the patient and manage her condition accordingly. So what you have to do in this type of scenario, you will simply go and you have to do what you have to examine the patient. So this is a post-hysterectomy hypotension. As I told you in the previous station, when you will enter the room, you have do the safety netting to the examiner. Examiner assume I have taken all the universal precautions, and then you will introduce yourself and you will acknowledge to patient, hello, it's Ahmad, one of the doctors here at this department. Could you please confirm your full name and date of birth? Patient will say Julie, like this is my date of birth, and then you will thank the patient. I know that you had a hysterectomy, you had operation done during the day, or you had this operation done an hour ago. So one of the nurses just called me and she's saying like your blood pressure is dropping and your oxygen is also dropping. So and then you will ask about the few things like after the operation patient may develop abdominal pain, patient may develop bleeding from the scar, or patient could have a shortness of breath, or patient may develop heart racing because it could be a PE, although it's very unlikely to have the PE in this type of scenario, like so it's so early to develop PE after the operation. And then you will ask about the cough, chest pain, any heart racing, leg swelling at the pain, and smoker's cough. Okay, so after that you will quickly ask, because patient blood pressure is dropping, patient had a surgery, past medical condition, medication, allergies is very important, but don't forget to ask about any blood thinners or the clotting disorders. Okay, so then you will see, I can see my patient is attached to the monitor, and I can see like my patient oxygen saturation is low, blood pressure is low, heart rate is 110, respiratory temperature is fine. So then you will say, Julie, I'm going to assess you. It will include look, feel, tap, and listen to the different parts of your body. Please be assured a member of medical team is with me, and you will point toward the examiner. He is a member of medical team who is acting as a chaperone, and we are maintaining your privacy. So after saying that, you will move forward and you will go on the airway. Okay, and in the airway you will see, as my patient is talking, I assume that airway is patent, but I can see oxygen saturation is 89% on room air. So I am going to start 100% oxygen at 15 liter via non-rebreather mask. That's all. So you will take the mask from the cupboard and you will put the mask on the patient nose. That's it. No need to attach to the oxygen. There will be no oxygen cylinder over there. So breathing, then you will go to the breathing. Julie, I am going to unbutton your shirt to see your chest, look, feel for the trachea as well, and comment on that, tap and listen to your chest. And at the end of the B, don't forget to order the chest x-ray, ECG and ABG. Okay, so once you will order the ABG, in the CC, in the circulation, they may tell you about the hemoglobin somewhere. Okay, so after that you will move to the C. Adam, I am going to pinch, you will see, sorry, it's a Julie here. I am going to pinch your finger to check for the capillary refill time, and will take your blood pressure and the pulse. I can see blood pressure is low, which is 80/60, heart rate is 110 beats per minute. So I am going to insert the 2 large bore IV cannulas into your vein. So if the 1 large bore cannula is already there, so you will say I am going to add 1 more large bore IV cannula into your vein, and then you will do what? I will take your bloods for the routine investigation, full blood count, electrolytes, blood group and cross matching. Okay, because this is a post-operative case, don't forget to request the blood group and cross matching. Okay, because most of the time, most probably this will be a bleed. Okay, and then what you will do, blood pressure is low, I will start the 1 liter of the Hartmann solution over the 15 to 30 minutes. Okay, then move to the deformity D. I will request just simply blood sugar temperature, and simply say, can you move your right leg, can you move your left leg for So then move to the exposure, that is examine the abdomen, legs and the private area. That's very, very important. Okay. And so then first of all, what you will do, assess for the bleeding from the surgical site. Okay. When you will see the surgical site, and at this moment, if anywhere in the circulation in the D, they tell you the hemoglobin is 70, this is a post-operative patient. So that what you will do at that moment, you will activate the major hemorrhagic protocol. You will activate the major hemorrhage protocol, and we request for the 4 units of the O negative blood. And then you will acknowledge the bandage covering the abdominal scar, which is dry. So patient had the surgery but scars looks dry. Okay, there may be a picture pasted on the SimMan tummy, so you will see scar looks dry to me, but definitely it was a big surgery. Hysterectomy is a big surgery, so you have activated the hemorrhage protocol because you are concerned about the internal concealed bleeding. So you have already activated the major hemorrhagic protocol because you are suspicious of the internal bleeding. Okay, patient is post-operative, catheter will be already in place, so you have to acknowledge. I can see that my patient is having catheter already, and which is draining clear urine. Okay, so if O negative blood has arrived, just simply start the patient on the blood transfusion, 1 unit every 10 minutes. So okay, after doing that, what you will do, move on to the plan, that is so then you will see once the resuscitation is started, what you will do, you will explain the condition and management, what you have done. Explain to patient, Julie, I can see like you had a surgery done today, and after the surgery I am suspecting you may have some bleeding, although your scar looks fine, but you may have some internal bleeding. So what we will do, I am gonna discuss with the team of the obstetric and gynecology for the further management. Probably they will do some bedside ultrasound, or we may do a further investigations including your scan of the tummy to rule out like what's ongoing. But it may need another surgery by the gynecology team, and they will assess you first and then they will make the decision. So at the same time, you can say I will involve definitely my senior in the emergency department as well. After getting the blood group and cross matching, I will order the blood according to your blood group, and we will do the further investigation under the gynae team, and then you will advise for the trigger of the disease and the safety netting. In the similar way, if there is some time, for example, examiner may ask you to hand over this patient using the SBAR approach, or on the scenario pasted on the outside of the room, it may be mentioned, can you please hand over this patient in 2 minutes at the end. So you will start with the situation. I am Dr. Ahmad. I am managing this 56-year-old patient, female patient Julie, whose blood pressure was dropping after the hysterectomy. Then you will give the background. Julie had a hysterectomy done an hour ago, and she doesn't have any allergies. Okay, then you will say about your assessment. On the initial assessment, her vital signs were like blood pressure was a bit low, heart rate was 110, and the respirator was 22, her oxygen saturation was 89. Okay, so I have given the 100% of the oxygen by non-rebreathing mask. We have started the IV fluid, and I have started 1 unit of the O negative blood as well, and I have requested blood group according to the blood group and cross match. Okay, in this way you will proceed, and then you can give what you can tell about your recommendation. After the initial in treatment, her oxygen saturation came to the 95%. My recommendation to continue the monitoring of her vital signs and response to the initial treatment, and after getting the blood cross matching result, I will order the blood group according to blood according to her blood group, and I would like to recommend a review by the obs and gynae team urgently, because this patient may need another operation, exploratory laparotomy, to stop the bleeding and to catch the source of bleeding. So in this way you have to hand over using the SBAR approach, and this is very simple case. If you have any question, you can directly message me or you can ask in the comments. Thank you very much.